Good morning. Greetings from Bangkok, from the Institute of Security International Studies. Welcome to our webinar today on the virus vaccine dynamics and challenges in the Mekong region. We have a lot of different events, but I think that vaccine and virus and also variants, these are topics that very much concern our lives. We talk about South China Sea, we talk about geopolitics, but none is so immediate and so consequential for our lives and our societies across the Mekong region. So welcome. And, I'll just proceed this way. We have a limited time. We have a number of speakers. I'll begin with the Dean of the Faculty of Political Science, Professor Ek Thangsappattana, and he'll lead off. And then after that, I'll introduce the other speakers. So Professor Ek, Professor Ek Thangsappattana, the floor is yours to lead us off.
Okay. Thank you, Ajahn Thitinan. Good morning and warm greetings to everyone. As the Dean of the Faculty of Political Science at Chulalongkorn University, I have the pleasure of commencing this webinar today with some preliminary remarks. Normally, ISIS public forums are held in person in a nice old building on Chulalongkorn campus. But for nearly 3 months now, the campus had been closed due to the first and most widespread wave of COVID-19 infections. So we have been working remotely and holding seminar and forum online. This webinar today directly addresses why we have to communicate virtually. We will be looking at the latest virus and vaccine condition, not just in Thailand, but a broader Mekong region and encompasses mainland Southeast Asia. The premise of this forum is that the Mekong countries need to be viewed both individually and collectively as a region. If Thailand moves ahead to vaccinate to the point of herd immunity, but other countries next door are not sufficiently inoculate, then Thailand cannot fully recover because its labor market, infrastructure, connectivity, and broader trade and investment are immersed with Cambodia, Laos, Myanmar, and also Vietnam. The Mekong region needs to re-emerge together eventually in order to move past this pandemic and regain its growth and development. Understandably, there has not been much effort to focus on regionalization of vaccines for the Mekong countries, because each of them is trying to survive and overcome the latest virus spikes across the Mekong mainland. But we can focus on immediate needs of each Mekong country while keeping an eye on regional collaboration and cooperation in the near future, including assistance from external partners. We will start with a few basic coronavirus-related tables, which the ISIS Thailand team have come up with. Then we will kick off today's discussion with Dr. Ledu Gash, a medical and public health expert from the World Health Organization in Thailand. Her brief presentation and accompanying data are telling and instructive on the status and direction of the pandemic and vaccination, including the efficacy of the first and the second doses of the main vaccines. We will also make her presentation slides available later in case audience members want to have further view. We will then proceed with a country perspective from Professor Pavida Punanon of Thammasat Business School on Thailand, Dr. Huong Letu of the Australian Strategic Policy Institute on Vietnam, and Ambassador Tu Sotilak of Cambodian Institute of Cooperation and Peace, Cambodia. These 3 countries fare well and effectively on virus containment, despite recent spikes over the past few months. How are these 3 countries doing on the vaccine front? What kind of and how vaccines are being procured and distributed in these countries. Although Laos and Myanmar are not covered directly, there will be references to these other two macro countries as well. I would like to sincerely thank to all speakers for sharing their time and expertise with us today. For your information, the record of this event will be available shortly afterwards on ISIS Facebook. Let me now turn proceedings over to Ajahn Thitinan, and thank you for tuning, and I hope you will be enjoy our public forum today. Thank you.
Thank you.ขอบคุณครับอาจารย์เอก Thank you very much. Let me ask our IT team to put up just a few indicative tables, please. The first table of the rankings of the coronavirus infections. So just for our audience member, as a way of being a little bit informal and being interactive, we'll just show a few numbers, a few tables, and then Dr. Renu will in fact expand on them. So you can see the US still the highest, number one, but the number in the US has really declined. Here in this table, you see that Indonesia is number 18, Philippines 24. So Indonesia, Philippines, quite up there among the total cases. I think the whole countries and territories, I think 215. So 18 and 24 pretty high. Number of deaths, in 55,000 in Indonesia, 23,000 plus in Philippines. And these are large populations, 276 million in Indonesia, Philippines, 110 million. So this is maritime Southeast Asia, not connected geographically by borders with directly with mainland Southeast Asia in the Mekong region, but the numbers are quite worrying in Indonesia and Philippines. Down the list, Malaysia is also worrisome. They've had lockdowns recently ongoing, very restrictive. Thailand, 6 months ago, Thailand would have been about 100 something. At one point, it was like almost 150. But now Thailand has moved up the table, which means it has more and more infections. Even today, the latest number is over 3,000, almost 4,000. And it has ranged around 2,000 plus, 3,000 plus, even crossing the 4,000 threshold in recent days. So Thailand has really jumped in the table of coronavirus cases compared to 6 months ago, let alone a year ago. Myanmar is holding steady at about number 86 with the total cases of about 150,000. But in fact, we can assume that the numbers are much higher. We don't have any reliable data out of Myanmar because after the coup on February 1st, the data collection and the entire vaccination program are hanging in the air, very problematic. There's a civil war. So Myanmar is a big question mark about what happens there, what is happening there on the virus and the vaccines. And Myanmar, of course, shares the longest border, over 2,000 kilometers with Thailand. So if Myanmar is having difficulty grappling, containing virus cases and rolling out vaccine, this is going to be a long-term challenge for Thailand and the rest of the Mekong region. And you come down to this list, Cambodia, Vietnam, Laos, much lower down the table, Laos 190. But there have been spikes in these countries as well, especially in Cambodia and Vietnam, including some lockdown periods there. Can we see the next table, please, our IT? And here is the vaccinations. Israel has led, is number 4 overall, with more than 63% first dose, fully vaccinated, about 60%. The US last year, a year ago, did poorly on the virus infections, but in recent months, it has really contained the virus and rolled out the vaccine. And it's fully vaccinated people, almost approaching half of the population now. And total cases have nosedived. So the US is at the forefront. Among us in countries, Singapore has done the best on vaccinations. 34% of the population, those with first dose, 46%. Total cases have held very steady now, almost on a pause, almost stopped. and population not large, but almost 6 million. Cambodia is the second best performing country in ASEAN for vaccinations. 16% fully vaccinated, 20% with first dose, and then you come down the table, you see Malaysia, first dose 12%, 13% fully vaccinated, 5%, and then Laos has also done well in terms of vaccinations, 10% first dose, 6% fully vaccinated. Thailand, less so, about 8% now. I think the numbers have to be a bit, this is tabulated 2 days ago, but the Thai authorities say over 8%, about 8% first dose, and fully vaccinated about 3%. And then Myanmar, again, unreliable number. We don't know, say 3% first dose, 2% full vaccination. But this really goes back to the previous period, early in the year. The recent 2-3 months, we don't have reliable numbers. And then Vietnam, and we'll hear more from Dr. Huong about Vietnam. First dose, 2%, 2.3%, but full vaccination, less than 1%. So here we have it. Can we have the third table, please? And just roughly, and this is from the Economist Intelligence Unit, which has to be, I think, up, but it gives us an idea anyway about the herd immunity, where maybe full reopening can be achieved, can be reached. Hong Kong, Singapore, UK, US, perhaps late this year, and then mid next year, maybe Australia, New Zealand, South Korea, Taiwan, Russia, and late next year, if not beyond, China maybe sooner than that. India, I think late next year would be the earliest. Japan, late next year. And then Malaysia, Thailand, Vietnam, late 2022 next year would be the earliest. And that would be a bit optimistic, I think, for Thailand and maybe Vietnam in terms of herd immunity, 60 to 70% of the population. And then beyond that, 2023 onwards, Cambodia, Laos, Myanmar, Cambodia maybe next year if they continue at this rate of vaccinations. So with that note, our IT team, please let's go back to the proceedings as speakers. We have a number of speakers, starting with the World Health Organization's medical health expert, Dr. Renu Garg. She will lead off with some very revealing numbers about and technical expertise about the vaccines, what kind of vaccines, how useful, efficacious are these vaccines, first dose, second dose, and then so we'll hear from Dr. Renu for 15 minutes or a little bit longer even, and then the other speakers will speak for about 10 to 12 minutes in the first round. We have Dr. Pavida Pananont from Thammasat University looking at the regional value chain, regional production with reference to Thailand, and then Dr. Huong Lê Tu from Vietnamese, but also now working in Australia at the ASPI, Australian Strategic Policy Institute. She'll talk about the Vietnamese prospective Vietnamese case, and then on Cambodia, my friend and colleague, Ambassador Pu Sotirak from the CICP Cambodian Institute for Peace and Cooperation and Peace from Phnom Penh. He'll talk about Cambodia. So, Dr. Renu, the floor is yours. Please take a little bit of your time because we can learn a lot and from your presentation expertise. Please go ahead.
Thank you, Dr. Thitinan. Good morning, everyone. It's a pleasure to join this forum to talk about virus, vaccines, and variants. At the outset, I'd like to acknowledge all the health workers and scientists working relentlessly around the world to defeat the virus. May I request for my slides? Yes, and I would also need help for advancing my slides, please. So can we go to the next slide? So I'd like to start with three key messages. First message is that the virus is continuously evolving and adapting. This is the nature of viruses, to change and adapt. And in the process of evolution, the virus is getting fitter and more efficient. And the latest variant that is detected is the Delta variant, is a highly transmissible variant, which is almost twice as likely to be transmissible than the original strain. And it is rapidly becoming the dominant strain globally. In fact, this is a big, significant threat to watch out for. The second message is, given that the spread of the variants, we need an accelerated vaccination strategy with a full course recommended and prioritizing populations that are vulnerable, those who are elderly and comorbid, because these are the populations which are at high risk of severe disease and death. Let me also remind that the aim of the vaccination is of any vaccination is to prevent severe disease and death, and not only to prevent infection, because no vaccine is 100%. The third message is that we can defeat the virus. We have powerful tools, and we need to use all these tools in combination. The public health measures of masking, distancing, etc., they work on the original virus as well as on the variants. And it's important to continue those along with accelerated vaccination, prioritizing the vulnerable populations, and a calibrated reopening which is adjusted according to the situation on the ground, and adaptation may be needed back and forth depending on the situation of the numbers and the spread of the virus. Next slide, please. So let's take stock of the virus spread in Mekong countries. This table presents cases per million and deaths per million in each of the countries compared with the world average. And as you can see, that in most of the countries, the cases and deaths are the scale of the epidemic is much smaller. If we take the example of Thailand, the number of cases are about a tenth of the global average, and the number of deaths are about a 20th. So, in general, most of the countries have done well in controlling the infection, but there are variations among the countries. May I go to the next slide, please? And in the next slide, it can be seen that these variations among countries, Laos and Vietnam, have kept the epidemic to a much smaller extent. From Myanmar, as Dr. Thitinan said, we don't really have reliable data. And Thailand is showing really the biggest spikes. The other point to note in this slide is that in most of last year, the virus didn't really take off in most of the countries. It's only this year, last few months, with the introduction of the variants, when the cases started to spike. And most recently, Delta has been identified in many of the countries. So the situation is likely to get worse before it starts to get better. Next slide, please. One point I want to highlight is that some populations, such as the migrants, are disproportionately affected. And this is again very important for cross-border discussions. The pie chart shows that in of all the cases reported in Thailand, about 20% are among migrants, whereas the migrant population is just about 5%. So in terms of infection rates, the infection rate among migrants is 11.9 per thousand population, which is about 5 to 6 times that among the non-migrants among the other groups. So this is really an important point also for regional cooperation for discussion. Next slide, please. So coming to the vaccine coverage, really the coverage is variable across countries, and it depends. It's highest among countries which have the vaccine than among countries which don't have the vaccine. It ranges from 53% in the US, percentage of people vaccinated at least with one dose, to just 2% in Africa. The global average is about 22%, and Mekong is on average is about 8%, higher than African countries, but way lower than the world average and also than Asia. Every day, about 40 million doses are being administered. About half of these are in India and China alone. So really, the next slide, please. The coverage of vaccines in in the Mekong countries, it really depends on the limiting factor is only the availability of vaccine. Again, there are variations. Cambodia has done relatively well, vaccinating at least about 20% of its population, whereas Vietnam is at 2%. Thailand is approximately 8%, and the only limiting factor is the availability of vaccine, because there is a high demand, and the countries also have a high capacity to administer vaccines, large numbers of vaccines. In Thailand, about almost 500,000 were being administered last week when vaccine supply, when the rollout started. But right now, it's lower numbers because of limited supply. Next slide, please. So let me touch a little bit about variants now. WHO has identified 7 variants of interest and 4 variants of concern. The 4 variants of concern, and these variants are named after Greek alphabets. So alpha variant, which was first detected in United Kingdom, is now reported in 170 countries around the world, and all the 5 countries in Mekong are reporting this variant. Beta variant, which was first detected in South Africa, is being reported in Thailand and Vietnam. Actually, in the south of Thailand, this is now has increased quite a bit, with several provinces reporting beta variants. And it is of concern because a beta variant has very low efficacy against AstraZeneca, which is the main vaccine to be used in Thailand. But so I really hope that these will be controlled and contained within the south and will not be allowed to be expanded to the other parts. The Gamma variant was only detected in Thailand in quarantine. The Delta variant is the most worrying. It has been already reported in 85 countries. It was first detected in India, and in the Mekong countries, Thailand, Cambodia, and Vietnam also have already reported, and we don't know the data from Myanmar. And we should not forget that Myanmar shares borders with India, and also Thailand shares borders with Malaysia. So there's also a lot of cross-border transfer of variants from other countries in the region. Next slide, please. The reasons these variants are of concern is one, because they are highly transmissible. So, for example, alpha is 50% more has higher transmission than the original strain, and delta is 50% more transmissible than alpha. So it's about twice as likely to be transmissible than the original strain, and that is really worrying. The other concern is that it also escapes immunity, and the vaccines may not be as effective. But by and large, against severe disease, vaccines are still working. The next slide, please. Um, so Delta is emerging as a dominant variant all over the world because it's highly transmissible. And in the UK, which actually has a reasonably good vaccine coverage, within a few weeks, the other strains were replaced, and the Delta has out-competed all the other strains to become the dominant strain, and over 90% of the new infections are Delta infections. Also in the US, just in a matter of weeks, the Delta variant has shot up from just 1% to 20%, and it's likely to become the dominant strain in the next few weeks. Not only is it more transmissible, but it's also causing more severe disease and hospitalization as per recent studies. So that is also very worrying. Next slide, please. This slide shows that the vaccine efficacy, there are a lot of numbers here, but I'd like you to focus on the last column, which shows that with 2 doses, the vaccines are pretty effective against hospitalizations for Delta virus variant. The other point in this slide is that with 1 dose, the vaccine has very low efficacy for preventing infection. So that is something of concern, and that's why the full course of vaccination is important. But by and large, the vaccines are effective against preventing hospitalization, which is the main purpose. Next slide, please. Now, one question that comes up is about what is the level that is required for herd immunity. There is no consensus on that magic number, but most people believe it is between 70 to 85% with an effective vaccine. And the data from Israel show that with a high coverage of vaccine, even up to 60%, but with calibrated reopening and adjusting the public health measures, it is possible to defeat and crush the virus. So that is an important message, that even though vaccination coverage will increase in the next few months, but we have to make sure that we don't open the floodgates, but have a calibrated reopening. Next slide, please. And again, another lesson from the UK, where with high coverage of vaccine, there was drop in cases and hospitalizations. This is when the alpha variant was in circulation, but with the delta variants, it changed, and they started to see an uptick, which was driven largely by younger people, as seen in the chart number 4. And so the lesson is that calibrated opening is required, and the UK actually deferred the reopening. They were going to open on 21st June, and they deferred it by a few weeks given the uptick from Delta. Next slide, please. Countries are having to make tough decisions because there are many unknowns and uncertainties. We don't know how much is the immunity, how long it will last, when the boosters are needed, whether mix and match of vaccines will work, and so on. There are also a lot of constraints. The biggest constraint is the vaccine supply, but also evolution of the virus to more dangerous forms. And Delta is the latest, but there may be other more dangerous forms as well. The best way to control these dangerous forms from emerging is to reduce the suppression through public health measures while vaccination coverage is being increased. Next slide, please. So in the Mekong region, the risk is quite high. There are many triggers. The emergence of variants is one, of course. The current low coverage of vaccine is another issue. There are also broader crossings, and they can be transfer of variants across the borders if not monitored properly. If the relaxation of public health measures is too soon, that can also cause upsurge, especially because of the variants. And also people are just getting tired, and they are dropping their guard. And if people start to not continue with appropriate measures consistent with the protection and suppressing the virus, all of these together can cause be triggers for causing surges in the virus. Next slide. I think this is my last slide. Yes. So I'd like to wrap up and end with by re-emphasizing on the key messages that we can defeat the virus, but defeating the virus will require a combination of all the tools that we have at hand, which is public health measures, masking, distancing, avoiding crowded, poorly ventilated places, hand hygiene, respiratory hygiene. These are proven measures that work against the original strain, and they work equally well against the variants. Along that, we need an accelerated vaccination strategy, prioritizing on the most vulnerable populations, that is the elderly, the people with comorbidities, and others at risk. And along with this, the reopening needs to be calibrated, and governments have to be willing to make decisions and tweak and adjust the reopening back and forth, keeping their eye on the ground, on the situation, and looking at the cases that are emerging. The virus will continue to evolve, and it is evolving, and that is the nature of the virus. We have to keep a watch on that. And finally, we need a rapid and accelerated vaccination, prioritizing the vulnerable groups. The aim of the vaccination is really to prevent severe disease and death, and not only to prevent infections. So I'll stop here and hand back to Dr. Thitinan. Thank you very much for a patient listening.
Thank you very much, Dr. Renu. could I ask the IT team to just focus on the last slide again, please? Dr. Renu, I'd just like to just ask you a quick follow-up question. Then, this is a very informative presentation with some insights and a lot we've learned from. Can you tell me, you have a point about hospitalization and prevention of a disease and death. So this means basically that the dosage, the vaccine can also mitigate symptoms and the contraction of the virus, right? So the idea is that maybe instead of having a heavy bout or severe cases, it could be lighter and therefore does not require hospitalization, because hospitalization is an issue now. The healthcare system is being overburdened. So maybe you just tell us a little bit about that. And then we only have 3 vaccines in Thailand. In Thailand, I want to just focus a little bit on Thailand, but also across the Mekong, the most prevalent vaccines are the Sinovac and Sinopharm. But from your presentation, the data are not so available on Sinovac and Sinopharm. And what does this mean for the resistance to the Delta variant? There's a lot of anxieties and worries and confusion about vaccines and variants. Should we be worried? Should the authorities be thinking about other avenues of vaccine if Sinovac and Sinopharm cannot control and contain new variants like the Delta variant? Thank you very much. If you could just answer quickly those 2 points about the hospitalization issue and maybe Sinovac, Sinopharm. Thank you.
Yes, thank you, Dr. Titinan. Those are really good questions. Now, that is in fact the main purpose of any vaccine, is to prevent severe disease and hospitalizations. And if we can do that with a priority to people who are most likely to be have those kind of severe disease, the elderly and the comorbid, then we can keep the rates of severe disease really low, and this will prevent overwhelming the health system. Because one can put up field hospitals to isolate cases, but really if the number of people who have severe disease who need ICU, the system cannot quickly create that kind of infrastructure and also trained manpower to deal with that. And so that is what is worrying right now in Thailand. Also, the number of people who are ventilated and require ICU is increasing, and it is very, very high. But the vaccines most of the vaccines that we have now do protect against severe disease. Both AstraZeneca and Pfizer, we have data for those. They protect against Delta as well. For Sinopharm and Sinovac, we don't have the data for against variants especially, but among other strains, the data shows that they do protect. They have more than 80% protection against severe disease in the countries that the trials were done. So I think the important point here is that we really need to prioritize people who can have the most severe disease, and with whatever vaccines are available, the accelerated vaccination strategy is needed.
Thank you very much, Dr. Renu. Your presentation leaves me with the feeling that early this year we saw the light at the end of the tunnel in a way with the availability, arrival of vaccines. But now it feels like the tunnel is getting longer, and let's hope we can still see some light and the light continues to shine. Let me move to our next speakers, and then I'll come back to you, Dr. Renu. I also want to tell our audiences that you may pose questions and comments along the way, and then we'll field questions and comments towards the end, the last 20, 30 minutes or so. Let me move now to Dr. Pavida Pananon of Thammasat University Thammasat Business School to talk a little bit about implications for Thailand, consequences for Thailand in the regional context, perhaps regional production. I know that you work a lot on global value chains, the value chains of vaccines and masks and so on. So perhaps sharing a bit of your research, and then go ahead, the floor is yours.
Thank you, Dr. Titinan, for having me on the panel of ISIS. And sorry to the audience, I prepared the slides, but I was a little too late to send it, so I cannot share it on screen. But I would just try to cover the message that I try to talk today. Uh, it's very nice to hear some of the facts and figure from Dr. Renu and also from what ISIS team has prepared before, because I think that the message that I would like to discuss also address a little bit on the supply of the vaccine, COVID vaccine. I actually title my talk as COVID-19 vaccine value chain and challenges for Southeast Asia. And my work is based on the studying the resilience of the global value chain of medical supplies from face mask, rubber glove, ventilator, as well as vaccine. But what I would like to share with you today is what Dr. Titinan has asked, which is the implication on Thailand and what we can take from understanding a little bit more of the value chain of vaccines. So just to bring out my key message that I want to convey today, I would like to address on 3 points. The first one is that not all countries are equal when it comes to access to COVID-19 vaccines. And the reason being 3 main points. The first is the characteristic and the nature of vaccine supply chain itself. And the second point is the state funding into vaccine research and development process. And the third key point is that countries who are early in ordering their vaccines would naturally get their vaccine first. So I call that first come, first serve. So those are my first point. I would elaborate this later on. And the second point that I would like to convey today is that we are talking about the regional ramping up of regional production for COVID vaccine in different ways. While production can be regional and Southeast Asia is now part of the vaccine production because Thailand has become one of the contract manufacturer for AstraZeneca. And Pfizer and BioNTech is looking into, not looking into, but decided to invest in Singapore soon. So while production can be regional, vaccine management is country specific. And as Dr. Renu has mentioned that Thailand is now facing some delay in vaccine rollout. And so that would lead to my third point, which I would then elaborate. What are the key challenges of Thailand's vaccine program in terms of its procurement and distribution? So just want to elaborate on each of the points. Sorry again that I cannot show you this infographic that I have prepared on the vaccine supply chain, and I call it from lab to jab. From the lab of discovery and development, the key point that the world is now going through at this stage is the mass production of vaccine and how do countries can source their supplies and who would be the manufacturers of different vaccines. That is now from the supply chain perspective. That's the key point. And then the distribution and the administration also takes place at about the same time. But that, as Dr. Renu has mentioned, that the supply access to supply is a key point in this. When we look at the type of vaccine value chain and when we look at the type of companies that are involved, we normally get to hear about vaccines by the biotech firms that research the type of vaccines, and that's we hear about AstraZeneca in collaboration with Oxford University. We hear about Johnson and Johnson, and we hear about Pfizer, Moderna, and Sinovac and Sinopharm. So those are the biotech firms that have come up with their type of vaccine based on different kind of virus, as we already know. But then there is also a group of the companies that we don't get to hear so much about. And those are the companies that do the manufacturing. And if we look at the different strategy of vaccine manufacturing, you would see that different companies would use different strategies. For example, some companies like Sinopharm or Bharat Biotech of India do all of their production in-house. Whereas some company, particularly AstraZeneca, is the one that has used the outsource the most. And I have prepared a table that show the number of outsourced manufacturer that AstraZeneca has. And it's quite interesting to note that AstraZeneca is the only one that has basically outsourced globally their vaccine production, whereas other companies, for example, Pfizer BioNTech, most of their production facilities remained restricted to France, Germany, US, Switzerland. So with all that, what I'm trying to say here is that if we look at the nature of vaccine production, you can see that a very few countries play dominant role in the supply chain of vaccine. We can even call this the vaccine club countries because almost 90% of the vaccine ingredients are sourced from these countries. And these are the US, the UK, Germany, China, Russia, and India. So as you can see that these are the countries that are also uh, except for India, which is now facing some serious supply challenge. Those countries are the one who get their vaccine first, not only because they have the money, but they also are the area of the vaccine club where most of the supply chain are sourced from there. And that prevent them from having bottlenecks that could happen from the supply chains of ingredients being blocked by some regulations in some countries, like what India experienced with the some ingredients from the US that are difficult to export to India. Another aspect is the funding that each government has put in. And here we would see that the big role of the US funding through their program, and that brings in a lot of money that goes into specific vaccine development. So that also explains why the US and countries that are behind all those funding in research get access to their vaccine. Uh, for Southeast Asia, as I mentioned earlier, that Southeast Asia has some limited presence in the vaccine production, and thanks partly to the Siam Bioscience in Thailand that has become part of this. But Thailand, despite being part of the vaccine production, we also face many challenges. If you look at Thailand's challenge when it comes to vaccine procurement, I think that we can see two characteristics that makes it very difficult to expand the inoculation program very rapidly. First of all, Thailand is quite late in getting into the vaccine procurement. The main doses of vaccine that we ordered were done at about November last year, whereas most countries that are now having most of their vaccine distributed to their population started ordering in May last year. So, and in addition to being also late, because we entered into the contract with AstraZeneca to produce through Siam Bioscience in November of 2020. And Thailand did not order any more vaccine until we start to experience the third wave in April and May. So only in May that we start to order more and to diversify our vaccine sources a little bit more. But that's still quite late because most other countries have already placed their order. And that brings the issue of first come, first serve into becoming part of the problem for Thailand in vaccine procurement. Another aspect of the procurement is that we tend to base the majority of our vaccine on AstraZeneca, and not just overall, but the local production of AstraZeneca. So Siam Bioscience is the company that is the first time producer of vaccine. So there might be some kind of bottleneck, some kind of challenge that we don't know what they are going through. But again, information is not that much available. So that's the procurement part. And I think when it comes to another key challenge for Thailand is the inoculation management when it comes to vaccine distribution. We can see that the country that does really well, that do really well, like Israel or Singapore in this region, or even the US, the control of vaccine is very centralized, and then it's managed in a centralized manner with very clear objective health criteria as the main priority for people who are older, people who have underlying symptoms. But in Thailand, as we have seen, the objective health criteria are not always the first priority. We have seen how people got very angry when particular large companies take priority over people who are older, 60 plus, and all those. That led to delay in the last 2 weeks. So again, this would be my last point of reiterating the key points that I would like to address, and that is not all countries are equal when it comes to access to vaccine. And when we look at vaccine, yes, vaccine production could be regional, and Southeast Asia is still better than other regions like Africa with no access to regional production. But again, when it comes to vaccine management, it's very much specific to each country. We can see that even Thailand, that has become part of the vaccine production, when it comes to management of the vaccine, we are still way behind even Cambodia or Singapore, which doesn't have its own production yet. So I think my concern would be for the regional is that if countries are not at the same level of capacity in overseeing their vaccine management, it would be difficult to see the kind of the regional average that we can hope for the regional herd immunity. Thank you very much. And now
Yeah,
I
thank you.
return to Dr. Thitinan.
Thank you very much, Dr. Parida. Very interesting last point about Singapore and Cambodia having done well with vaccine rollout, vaccinations, and not being a manufacturer. So, you know, the point about being a manufacturer and then, you know, sort of manage individually, but making it for the region collectively, that's a kind of a big role Thailand's been playing. But I think there's some shortcomings here. And I wonder if you can just answer quickly, just say what you think. The situation in Thailand now, we're in Thailand, is it a bit of a, in its own trapping, the Thailand, are we in our own kind of trapping? On the one hand, virus numbers are very high, 2,000 plus, 3,000 plus, 4,000 plus, but on the other hand, vaccines are still very slow. So until vaccination reaches a certain point of critical mass, we will have a problem of more and more infections. And then this becomes a dilemma because another lockdown the Thai government and authorities want to avoid because of the economic damages and livelihoods and so on. But on the other hand, infections are going to keep going up while vaccines are not being rolled out sufficiently. So this mismatch is a bit of a kind of a trap. What do we do about that? What do you think, Dr. Parida?
I think as Dr. Renu has stated earlier, that when you open up the country, you have to also look back and forth toward what kind of priority you're placing on. And I think with Thailand being the country that is very dependent on tourism and export and all those, the concern for economic is very much a priority at the moment. And that's why we are looking at opening up Phuket at the beginning of July, in less than 10 days. And the Prime Minister has already stated that he wants to open Thailand in 120 days. So that point out to a concern on economic concern of companies and of business in hospitalities and hotels are asking for opening up. And I think that if we do not take into consideration the kind of the public health concern, we would be in a trap, as you said, that we still are waiting to hear from where the supply can come. Although we have been hearing a lot about talk of ordering more vaccine, but it doesn't arrive in a week or two. So all this needs to be planned out, and I think it needs to be better managed in terms of getting information to people where we are rolling out and how much we need, and what kind of control or opening we are talking about. And with a lack of all those transparency and disclosure, I think that raised more of concern from the people, especially when the kind of information we hear more clearly is from the public health concern, like what we just did.
Okay, thank you very much. Well, let me move to Vietnam, Dr. Hong, and of course, Thailand is not alone in having difficulties and adversity confronting this virus challenge and vaccine dilemmas. What has been the experience of Vietnam? Vietnam has been a stellar performer on virus containment all through last year. It ranked nearly the bottom. And it had a quick lockdown, and it looked like everything was under control. But now Vietnam is seeing some spikes, not as bad as Thailand, but there's been a very slow rollout of vaccines. And also the second point I would like you to cover maybe is Vietnam has been reluctant to use Chinese vaccines because of geopolitical tensions between Vietnam and China. But now maybe Chinese vaccine is welcome or not? And what's the Vietnam vaccine plan? If not Chinese vaccines. Please, Dr. Hong, the floor is yours.
Thank you, Dr. Thitinan. Thank you, Ajahn Thitinan, and Khop Khun Khan. Welcome to everyone. It's great to follow Dr. Renu's and Dr. Pavinda's presentations because there are many shared issues that Vietnam also suffer. And I'd like to, Dr. Renu and gave a little bit of more of public health perspective, and Dr. Pavina about the supply chain. Let me try to offer a little bit of political and geopolitical angle to that. So like you said, Dr. Thitinan, Vietnamese numbers, as you showed in the beginning of this webinar, weren't too bad in comparison to the world and the region, in fact. And still, I think in terms of numbers of infection as well as the numbers of death, Vietnam still ranks relatively well. But I think even for that standards, the recent wave has caused a lot of worry precisely because, as you identified, the vaccine strategy seems lagging behind. So if we roll back a little bit of time, the last year Vietnam's performance was stellar, as you said, one of the best in the world, not only in terms of public health, but also in terms of economic. Vietnam, after last year, came out the least hurt economically in comparison to the rest of the region, and seemed to really be confident, was the first one to reopen in late April last year. This time last year, domestic tourism was surging. My relatives were traveling. There seemed to be minimal, if any, restriction. And we saw a number of waves back and forth. But every time, then in July and then in January when UK variant arrived as well, but every time Vietnam was relatively fast to get a hold and contain the spread. This time around, around the Delta virus, which is so much more infectious, I think Vietnam is struggling a little bit with the containment. So we still have back and forth numbers in hundreds. So the biggest clusters in around Ho Chi Minh City and then Bắc Giang province as well. So the biggest clusters are around Ho Chi Minh City as well as Hanoi. So two big kind of clusters. And Vietnam has reimposed restrictions, and I think it got people worried because it's this time takes a bit longer to contain. First of all, because of so much more infectious variant, but also because so little of population is fully vaccinated. It's just below 1.0%, which is the lowest in the region, even below Timor, and even below Myanmar, which as you point out, is in the middle of civil war and really big crisis. So what went wrong? So the question is, what went wrong? I think there are I would categorize in a number of factors. First of all, I think there was an element of complacency because countries that dealt well with the first year of vaccination tend to be a little bit slower in vaccine rollout, and similarly is the case here in Australia as well, where the numbers were low, but with vaccination, you will wait longer for vaccination to fully roll out, simply because there's less of that urgency, unlike, for example, in Indonesia or US, for that matter. The second factor I would identify, because Vietnam had in early this year the 30th Party Congress, a very big and very important political event where the top leadership has been changed, and we had also seen the National Assembly elections in May. So all this period from early this year, even late last year, preparation to that. But during the political power transition, I think there was a lot of attention being taken away from this urgent task, which also took a little bit of political energy. I also would point to the fact that Vietnam had been quite innovative during the first year of COVID. So its responses included a lot of innovation domestically, including its own test kits and a number of domestically homegrown vaccines are being in different phases of clinical trials. So there wasn't an element of waiting for our own vaccine. So like Dr. Pavinda said, it's really about, when it comes to securing supply of vaccine, first come, first serve. So I think that contributed to Vietnam's a little bit slower efforts to secure supply chain, and then it found itself in a very bad situation of very hard to secure those supplies when of course it was hugely in demand across the world, and to the degree that Vietnam had actively use diplomatic channels to open up for donations and all kind of support from international actors. It is now also actively wanting to purchase vaccines, and I think the last factor I would point out is also porous borders, right? Every now and then we hear stories about illegal crossing of borders that were either from China, Cambodia, and other countries that might have, or sometimes there are, or there might have gone untested, uncontrolled. So there are those also factors that contribute to the spread this time around. Now, I wanted to give you a number that I saw that confirming what Dr. Renu said, that to achieve populations immunity around 75% must be vaccinated, and that would need 150 million doses for Vietnam, or amounting of Vietnamese over 25 trillion Vietnam dong, right? It's a lot. Vietnam right now, it says it has around 14 trillion to cover, Vietnamese dong to cover this expenses. It's so short of 11 trillion, so almost half. So it has opened up. It has text, from institutions to private people about encouraging to donate, to make donations to the vaccine funds. But I think to answer your later question about the China's vaccine diplomacy in the picture. So in the first year, China was very active with so-called pandemic diplomacy, with masks, tests, PPEs across Southeast Asia, except for Vietnam. Actually, there wasn't that many visits or offers coming from China to Vietnam. In fact, in the first year, Vietnam was the one who donated a lot of masks, test kits, PPEs to neighboring countries in Southeast Asia, but also much more developed countries, including the US, EU, Israel, and a number of even Singapore countries. Now, the situation, as we know, turned a little bit around. But with the Chinese vaccine, I think there's a little bit more to the story. I think Sinovac was approved early on, and recently Sinopharm had just a few days ago has donated to Vietnam 500,000 doses. But actually, it is said to be catering for Chinese population living in Vietnam, or business people, Chinese business people doing business in Vietnam as priority. I don't know if any of that remaining will go to the Vietnamese people or not. But I also heard that it is only for emergency uses. So I think right now Vietnam is in a shortage of vaccine, and will probably not be discriminatory in terms of the source. It has one of the more kind of diverse portfolio of vaccines among Southeast Asian countries, because it has AstraZeneca's around 30 million, I think, doses. AstraZeneca, and Japan also donated another million for last week, also AstraZeneca. It has Moderna, it has Pfizer, it has Sputnik vaccine, around 20 million, and it is waiting to either later this year or early next year to roll out. It has 3 of its own vaccines in the trial. So it will have a very diverse portfolio of different vaccines. I don't know how that would translate into, the herd community, and I don't know also what going forward countries in the region will treat or recognize each other's vaccines passport, whether it would be determined by which vaccines you have, or whether you have vaccines or not in the first instance. And also, Vietnam is hoping probably also for a number of support from, because it is eligible for COVAX. It is unclear how much it can get from the external funds, including, the Australia's, the US, and Quad partnerships and others pledged vaccine supply to the region. It's not clear in terms of division how much that would end up in Mekong region or Vietnam in particular. But I think Vietnam is kind of waking up to the challenge right now, because it realizes that if this is not done well, it really challenges and might really challenge its stellar reputation in terms of a vaccine response. That's one thing. But another thing is also the 13-party Congress that I mentioned earlier this year had set very ambitious plans for Vietnam's economic performance. And without getting its vaccine strategy in place and really, kind of carefully reopening up, it is going to be hard to achieve those ambitious plans, and ultimately that would have also political consequences. I'm about to hit my 10 minutes mark, so I probably will leave it here, if that's okay, Ajahn, and I look forward to this later part of discussion. Thank you.
Yeah. Thank you very much, Dr. Hong. A lot of takeaways. It's interesting that you mentioned that China is taking care of the Chinese in Vietnam. China has been taking care of the Chinese in Thailand as well. So the Chinese vaccines from China for Chinese citizens outside China, this is one of the trends that we're seeing in the region. You also mentioned about the Vietnamese government. I think government capacity to deal, manage, mitigate is very important. And the nature of governments, Vietnam has a one-party rule, And unlike some of the other countries that have more open kind of multi sources of power and authority, maybe a little bit easier to get things done in Vietnam in the earlier stages at least. And then China, I have to make a note about China. It's an amazing performance. In the beginning, China was #1 in the world for the number of infections. At this time, China ranks around number 100. It's basically put a stop to the virus infections, more or less with marginal spikes here and there, but largely contained. And the vaccine rollout is spreading out methodically. But what's interesting, Dr. Huang, maybe you can address this. China is rolling out vaccines for its people inside China, but also at the same time making Chinese vaccines available for people outside China, for other countries through vaccine diplomacy, donations, as well as sales. In Thailand, we're just having this week the introduction of Sinopharm. Earlier, the Thai vaccine, default vaccine has become Sinovac, just because the AstraZeneca has been in short supply. And we can see this trend around the region. So, in terms of having a vaccine regional plan, regional strategy, regionalization of vaccine, I mean, the Chinese have a plan. The US, they announced a big 500 million and, a lot of the vaccines coming from the US, but I see as unfocused. It's going to COVAX, which is great, and COVAX would redistribute to all kinds of countries, including Southeast Asia, but it's not focused regionally per se. Another country I can see having a kind of a regional focus, regional strategy for vaccine assistance is Australia. So maybe, I'll just ask this one quick follow-up question. Since you're sitting there in Canberra in Australia, the Australians seem to have a regional plan for Southeast Asia, right? What do you see there?
Yes, so I think Australia was quite early to recognize the need, especially, it came out from the Pacific Step Up and taking care of the Pacific neighbors, and I think that also included all Southeast Asian. So it has been quite active in contributing to COVAX, of course. I think it donated quite a bit for the COVAX. I think 12 million doses to Southeast Asia last year. It has, included vaccine and pandemic recovery in its foreign policies, and it came in different ways. For example, last year at the East Asia Summit, the Prime Minister Morrison announced, over 500 million Australian dollars to that big public health security initiative. It is unclear how much of that would actually go to Southeast Asia or Mekong in particular, but it's a big commitment. It also committed to the recent Quad leaders Quad vaccine partnership. It also committed to Prime Minister Morrison also went to G7, where he pledged further commitment to the vaccine partnerships, another 20 million doses, I think, at G7. So it's been accumulation of a lot of assistance coming from Australia, 100 million from the Quad partnership, which also will be distributed across the region in its partnership with the US, Japan, and India. But Australia itself also is a little bit slower in terms of rollout in its own country. I think Australia primarily sees it as a foreign policy tool, probably as substitute for its kind of development aid and development assistance that it's been stronger in the past. So I think vaccine diplomacy is strong, and vaccine commitment is also strong. Strong recognition from Australians' foreign policy establishment.
Thank you very much, Dr. Huang. The geopolitics of vaccine is very interesting because the Chinese have made geopolitical inroads, further progress even than before on vaccines. It's ironic that the United States, they have the best recognize vaccines, but we're not seeing it in Southeast Asia so much. I think the Singaporeans have had a lot of Pfizer, Moderna, US vaccines, I think predominantly. Philippines has had a little bit, but the rest, especially in the Mekong region, mainly Chinese vaccines and then the AstraZeneca. So we'll come back to these points. I just find that the geopolitical implications and the trends are very, very interesting, and it's a vaccine window that the US, I think, is maybe squandering. Ambassador Pusotirak coming to Cambodia now. Cambodia, a lot of vaccinations, and I don't know if you yourself have had your vaccines. Maybe you already had complete vaccination, probably. But in fact, the second ranked second in among ASEAN countries. What do you see there in Cambodia in terms of mainly Chinese vaccines, right? Not Pfizer, not Moderna, not Johnson & Johnson, AstraZeneca, and then vaccine diplomacy. There's a perception that Cambodia has been leaning so heavily, almost solely on China, that it's all in everything for the Chinese vaccines. Is that the case? And then there's a link to the other issues about China's role in Cambodia and Cambodia's role in China's geopolitical outlook. Ambassador Sotirak, please.
Thank you very much, Ajahn. First, I'd like to express my sincere appreciation to my dear friend Ajahn Titinan for inviting me to take part in this very important discussion, a topic I think it's so vital to the survival of all of us, all mankind. And I've learned a great deal from country specific just now, particularly on neighboring to Cambodia, Thailand, and Vietnam. And I really appreciate the presentation made by the representative from the World Health Organizations in Thailand. My presentation will mainly focus on Cambodian experience on how we handle COVID-19, both the success story, and I will talk a little bit about the challenge that remain. And if I still have time, I will make some quick comment about issue concerning regional approach that include vaccine diplomacy, as everybody else is trying to expose. Now let me go straight to the Cambodian experience in handling COVID. First, the success story. In terms of prevention and protections, COVID-19, Cambodia have a solid record that is borne out by statistic and by serious commitment of the government to safeguard the life of all citizens in Cambodia. Mass vaccination in Cambodia has been swift and successful compared to other countries in Southeast Asia. As of 22nd June 2021, about 3.5 million people have received the first dose of vaccine, while about 2.7 million people have received the second shot. Cambodia aims to vaccinate at least 10 million among those who are eligible to be vaccinated out of its total population of 16 million by the end of 2021 or early 2022. And this means Cambodia have achieved about 30% of its goal in terms of vaccination compared to regional neighbor. And as everybody know, we rank quite well in ASEAN, just second below Singapore. Another success story have to do with the ability of vaccine that Cambodia able to gather. Most of the vaccine that Cambodian have used are from China. Since February 2021, Cambodia have acquired about 8 million doses of COVID-19 vaccine from them. Cambodia bought from China 6 million doses of Sinovac. China donate to Cambodia 1.7 million doses of Sinopharm, and COVAX donated to Cambodia about 300,000 doses of AstraZeneca. I received my 2 shot from AstraZeneca already. The ability of the royal government to acquire and diversify COVID vaccine for all age of the population is exceptional and have to be complemented. Cambodia have received, as I mentioned, AstraZeneca and vaccine from China mainly. At the moment, negotiations still continue with China, India, and Russia for further acquisitions of vaccine brought by the end of 2021. Cambodia welcomed the decision by the US to include Cambodia in the second plan of distributing 16 million COVID vaccine to Asia through COVAX, announced most recently on 21st June this year. So Cambodia is pleased with that, and I think the US ambassador here in Cambodia have already made this known to the government of Cambodia. Now, another success story have to do with the ability to distribute reliable information to the public at a constant pace, and the ability to combat against COVID-19 misinformation for the public awareness. This is done through Ministry of Health, who's mainly the focal point in sending out numbers, location, and region of COVID-19 infected every day. I'm saying every day, and then it's alive. There is a website we can access. Another ability of worth noting mentioning is the close working relationship with the Ministry of Health and the WHO here in Cambodia, particularly in COVID safety guideline to try to stop the spread of COVID-19 in Cambodia. Now, you might want to know, I don't know whether in Thailand have a tracing mechanism that the royal government put in place in managing COVID-19. The Ministry of Health use the so-called Stop COVID-19 QR code system that help monitor and trace the development of spread and the infections of COVID-19 throughout Cambodia. This has been very well received by the public. Another good shot by the government is decentralizations the authority to the provincial and municipality authority to set their own COVID protocol to control pandemic in their own provinces and community. This has been also a good example how Cambodia want to actively and comprehensively cover vaccination throughout the country. Now, all these successes attributing to a strong and effective leadership of Prime Minister Hun Sen, who was able to mobilize state resource and relevant institutions to act swiftly and to remove any threat of community outbreak in a timely manner. Compliment should also be given to all health workers and all other authority concerned in Cambodia who have done an excellent job. Now, despite this resounding success, there are fundamental challenges that I like to take this opportunity to share some of my own thought. This is not just getting people vaccinated alone. I think that all government, and no exception to Cambodia, have been overwhelmed with such measures related to tracing, isolating, testing, and curing the affected victim of COVID-19. These governments are preoccupied in what I think that they want to know what to do during this crisis, what to avoid from getting infected, and what vaccine can cure the virus. The COVID-19 outbreak should be treated as a wake-up call for all nations, especially Southeast Asian nation and CLMV Thailand, more particularly to strengthen and revitalizing their public health care system. I said this because Cambodia needs the most to revitalize and strengthen their healthcare. We need to reinvigorate our healthcare sector, as this sector have to deal with the emergency crisis born out from this pandemic. Cambodia must, in my opinion, aim to put in place an effective and integrated public healthcare system that is efficient and capable if the country wishes to flatten and prevent the pandemic to remain in this country any time longer. An ideal public health care system must begin with the convictions that adequate, affordable health care should be available to all individuals. This means that all health care centers must be adequately provided with qualified medical professionals and supply and back up with appropriate equipment and medicine, and and the allocations of sufficient budgetary resources to sustain a resilient public health care services. Now, the government also lack resource to help in particularly on vaccinations, help the vulnerable groups, especially the poor who live on a marginalized. As the economic fallout have felt so strongly, you probably hear even help. I mean, government worker, most of the government worker who have been affected or targeted as a potential victim to COVID, they cannot earn money, and so they live on handout, and government have a lot of difficulty in meeting this requirement, and therefore we need to have to think about a more longer term social safety net that can mitigate these social issues. Another problem that we see recently, particularly in my view, the government does not have holistic plan and strategy in how to help Cambodian nationality abroad, especially migrant worker, to cope with COVID-19. This is serious given Cambodia, who have about 2 million migrant workers legally and illegally working in Thailand and Korea. Embassy have done some work, but basically, what I feel is there is no bilateral discussion between the government of Cambodia and Thailand to try to look after those Cambodian who work overseas, particularly in Thailand. There are some report there. Now, I think I still have time. I want to say a few words about what I think the regional approach surrounding this COVID-19, of which I think is very important. Everybody know that coronavirus cross national border, and therefore regional response make a lot more sense. But regionalism can only work well if individual states do not retreat into isolation, nationalism, and protectionism, which undermine collective response. Regional response cannot or will not work when governments all over the world trying to isolate their individual country by moving inward, enacting unilateral ban on travel and imposing trade restrictions, and work to protect their citizens as though their individual territory is the only country exists on earth. The applications of exclusivity of state sovereignty over its territory have been applied in way not seen in modern history. This is everywhere, not just Cambodia, but everywhere. The Mekong country of Cambodia, Laos, PDR, Myanmar, and Thailand and Vietnam have been experiencing to some degree the impact of COVID pandemic, to some different degree the impact of COVID-19 pandemic. Policy implemented by the Mekong state have include restricting people movement and large-scale gathering, contact tracing, testing, and vaccinating, as well as aggressive public awareness campaign. As the pandemic situation move into a massive vaccination state, the Mekong country do risk being left behind, as is well demonstrated by a sample glance at the vaccination rate in the Greater Mekong sub-region. Vaccine diplomacy from COVAX, the United States, China, and Russia will certainly be of benefit, particularly as the US and China compete to display their generosity, a rare but positive externality for the sub-region of the two states increasing competition. In August 2020, during the third LMC summit, China Premier Li Keqiang said that China would give Mekong country priority access to COVID-19 vaccine, creating special fund to promote public health corporations and continue to provide anti-pandemic material and technique support. Why just this month, Washington declared it would provide 500 million doses of vaccine at no cost globally. I told you already that Cambodia is in the list that the US will also be providing freely vaccine. On the questions of political stability, the pandemic has significantly heightened the socio-economic inequality, and in that inequality is often the root cause of political instability. The key challenge to government in the region is to ensure an inclusive recovery, and inclusivity in vaccination is a core element, therefore ensuring all access to all rather than to some of the elite. And representative from Thailand have made the um, uh, case very well about first come first serve. I think that need to be reviewed. The effectiveness of sub-regional cooperation depend on how regional states trust each other, how well they can coordinate their cooperative action, and how can they appease the vaccine nationalism. Overcoming these challenges seems to be a realistic basis for which to build future policy toward a more vigorous regional response to COVID. Everybody know that ASEAN have a COVID cooperation mechanism in place, at least in express statement is concerned, as well as the ASEAN +3. I have not seen anything concrete out of that. Maybe we should ask ASEAN altogether how they would want to help CLMVT combating COVID-19, as well as the +3 country. Now, country that failed to initiate a period of pandemic, particularly the United States and United Kingdom, have impressively recovered, and with the vaccine rollout and their critical mass in reaching mass herd immunity is very resounding. And this for this, I think the Mekong sub-region should not be complacent and cannot allow itself to get trapped in a position of being locked out or of a reopening global economy that we begin to see now. People talk about exit policies, post-COVID recovery, economic recovery, and so on and so forth. So they must work harder to reach a critical mass of herd immunity as soon as possible. Now, in my last point with regard to regional response, in terms of next step, CLMVT face challenge of coordinating in the region. Coordinating is a major concern. If there was a time for the Mekong state to come together and work together with a single led multilateralism entity, it is now the time. But we don't know who's going to take the leadership role. I only can make this statement. I have no suggestion as to who within CLMVT should take a lead in fostering this regional approach among ourselves. To avoid further politicizing the issues such as such entity, the entity that we talk about that can galvanize a regional response, need to be the one that based within the region and yielding the questions and proposal that can effectively respond to coordinate and to facilitate sub-regional approach that engage all of our global partner, which placing the interest of the Mekong state at the forefront and the people at the center of the regional-led approach. So I stop here. I have some recommendation for at the end. If I have time, I will speak more. Thank you so much.
Thank you. Thank you very much, Ambassador Pu Sotirak. A lot of takeaways. Cambodia has done very well during this vaccine stage, the virus stage as well as the vaccine stage. And then you made a very good point about the government capacity to stay on top of the challenges from early on and still on top. In a way, Ambassador Sotirak, Cambodia had the best of both worlds in a way, because it joined COVAX, so it benefited from the COVAX vaccines, had COVAX access, but at the same time also had access and availability of vaccines from China. So both the Chinese vaccines and other vaccines through COVAX, including from the US. You also mentioned about the various cooperation between WHO and the health WHO and the local health ministry, and also the decentralization, and also Cambodia now, Ambassador Sotarak, is on course to be the first in mainland Southeast Asia, Mekong region, to be the first to probably achieve herd immunity at this rate. And herd immunity now, we're hearing from Dr. Renu Garg of the WHO, and I think the WHO is saying 60% to 75% was what we understood earlier. But now the number seems to be 70% to 85%. That's a high number of herd immunity, of critical mass. But Cambodia is ahead of the other countries in the Mekong region. So the point of this seminar, partly, Ambassador Sotirak, if Cambodia achieves herd immunity, the Cambodian workers work in Thailand, and Thailand is still grappling and struggling with virus and variants. That will eventually, ultimately affect Cambodia adversely as well. So that's why we need some kind of a regional remedy, a regional plan. Otherwise, if Cambodia achieves herd immunity, Vietnam does not, Thailand does not, it's ultimately still Cambodia's challenge. And you mentioned about COVAX in US and China. I want to emphasize this point. I want to turn back to you for your view very quickly. COVAX, US and China can both compete and cooperate through COVAX. Both have vaccines that are being used around the world. I think the US is a bit slower to make the vaccines available, but now they're trying to catch up. The Chinese vaccines have been around for a long time. So if COVAX can use both vaccines, both countries, and also the Russians as well, then maybe that's a way of constructive cooperation between the two superpowers. And if they can focus a little bit regionally in the Mekong region, perhaps that would be a way forward, Ambassador Sotirak. And do you see any concrete, just one or two concrete way of Mekong cooperation? I know it's difficult to see because each Mekong country is struggling on its own. To think, of a regional plan, regional cooperation is very difficult because each is struggling. But if we were to be able to see beyond individual country, can you conceptualize a regional framework across the Mekong countries because of porous borders, geography? We need each other. Ambassador Sotirak, what's your one or two recommendations?
Yeah, very good point and very good observation, Ajahn. I agree with you totally that in the context of moving ahead and being able to withstand not only COVID-19, but have a solid exit policy that address economic recovery as well as political stability in the region, CLMVT face two big challenges, and I will try to answer your question using Cambodia. But first, CLMVT. The first challenge is how to raise Mekong issues to the level of priority as of something akin to the South China Sea within the ASEAN, the whole of ASEAN. This is a challenge, a big challenge. And this what is done if ASEAN does not recognize Mekong issues as priority. This will leave a lot of room for China and US to exert bilateral influences separately. They don't cooperate when they exert this. This is a problem to the Mekong country as well. The risk of choosing side is quite obvious, but everybody avoid discussing this. But it's there. If the two power continue without trying to consolidate or regrouping themselves, even on development issues such as infrastructure in the Mekong region, country in CLMV will have difficult time in going forward and maybe a source of division within ASEAN in the long run. We cannot overlook these issues. And you raise a very pertinent point about COVID policy that need to be jointly established, starting from CLMV. Yeah, Cambodia are doing very well, but I think at the moment we do not. My reading is that the government does not have a vision to try to engage in a collaborative way with other country. We're doing very well on our own, but my point here is that nobody is safe until everyone is safe. This is a principle that I look at, and this is also the message that Dr. Fauzi from the World Health Organization also uh, time and time again emphasized. And so we need to use this cross-border platform to try to do, as I mentioned, ASEAN have COVID joint statement. ASEAN plus 3 have one, but what's exactly they do? It's not. It's unformed in my view. It's just wishful, aspirational statement. They have to do more. But CLMVT also have to take initiative. Now we have, like you mentioned, we have, for example, Cambodia is in a sort of like a exceptional position in trying to bring China and US together to try perhaps to have a CLMV plus two, China and US to converge on this regional approach that can address this vaccine diplomacy quickly so as to enable everybody to open up their economy as soon as possible. And this is my view. Thank you.
Thank you very much, Ambassador Pusotrak. We have a number of questions now from our audience members. I'll just table the first three, and I'll invite first Dr. Renu Garg of the WHO to answer as you see fit for 2 to 3 minutes, and then other panelists are welcome to entertain these three questions for a minute or two as you see fit. First, Dr. Renu, there's a question about the slow vaccine rollout, the slow vaccine availability. Is it possible to look at other alternative remedies, alternative antidotes? The question mentioned Tamiflu, but can there be other antidotes and other remedies short of the vaccines, the conventional vaccines as we know them? And second, the dosage interval. This is also a puzzle to me. I mean, what's the optimal interval of the AstraZeneca between the first shot and second shot, or the Pfizer first shot, second shot? We don't have Pfizer around here yet, but AstraZeneca mainly. And if the interval is too long, would that dilute or undermine the efficacy, the usefulness of the vaccine? And then the other question, this is all from our Facebook page, by the way. The vaccine, maybe Dr. Pavita can say something about that. The vaccine manufacturing. Now that Singapore has entered the manufacturing fray, Singapore also will be manufacturing vaccine. I think it's Pfizer in Singapore. Would that contribute positively to the supply shortage, the supply issues? So perhaps we can start with those three questions. First, Dr. Renu, the alternative remedies and antidotes other than the vaccines that we know, and then the intervals between doses. Please go ahead.
Yes, thank you. As far as alternative measures, we know that from the Solidarity trial for drugs, the 4 drugs that were used, the other antivirals did not show effectiveness against the endpoint of reducing mortality. So unfortunately, we don't really have, other than dexamethasone, which is known to reduce mortality by a third among severe cases. We don't really have any other therapeutics. But WHO is now starting another trial, phase 2 of the Solidarity trial with other drugs. But in the near term, we don't have any solution to that. But the public health measures do work. So those are powerful, and those are the alternatives to vaccination. The second question about the dosage, the interval. Now, WHO for AstraZeneca recommends 8 to 12 weeks. And when in the UK, they use a strategy where they covered a high proportion of a cohort with one dose, and they gave the second dose at 12-week interval. And according to some data, if the efficacy of a single dose is at least 50%, then covering a high proportion of the population with a single dose first, and then with a longer interval, actually helps to save more lives. But that is if the efficacy of the first dose is at least 50%. Now, with the emergence of Delta variant, where we have seen that with AstraZeneca and even with Pfizer, the efficacy of one dose to prevent infection is only 33%. The interval really needs to be 8 to 12 weeks, and some countries which had extended the interval to 16 weeks have reverted back to 8 weeks. So we would say that the interval should be as recommended to 8 to 12 weeks because of the emergence of the variant. Back to you, Dr. Thitinan.
Okay. Thank you. Thank you very much. And there's a question about the regional supply. I mean, there's been a shortage of supply of vaccines in Southeast Asia, but now that Singapore is going to make vaccines, manufacture vaccines as well, and South Korea as well, I think, but around here, Singapore and then Thailand, would this improve the situation and provide vaccines more adequately? Dr. Pavida.
Yes, Dr. Thitinan, thank you for the question. I think the regional supply chain, what is happening right now is that we have to bear in mind that this is the first time that COVID-19 vaccine is being manufactured for the first time. And the period that it takes is already very rapid. But now we are seeing the need to ramp up the regional production. And although, as you mentioned, that there is some regional production facilities already in the region, Japan, Korea, and Thailand is now part of it. And BioNTech is looking at starting their production in Singapore. But that would not be until 2023. So at the moment, I think we are trying to see how the most rapid one. So for the new facilities in Singapore, it certainly would be useful later on, and it will not just be for COVID vaccine. It will be BioNTech facility in Southeast Asia. But I think for the need for COVID vaccine at the moment, to wait for Singapore probably might be in the longer term, but in the short term, we probably have to look at those that are already in contract for the manufacturing.
Thank you. In terms of more supply, apart from the vaccines that we know, there are also domestic efforts to make vaccines. In Vietnam, Dr. Huong, how far along are the Vietnamese health authorities to make their own Vietnamese vaccine? And you mentioned 3, right? Are they on course anytime soon?
Yes, so there are different stages of clinical testing. I think, if I'm not mistaken, one of them is just, at least there are also efforts to have a single dose vaccine. I'm not sure how far off is that. The initial idea was, I think one of the stronger candidates for vaccine is to have by around September this year. The rest, the hope is late this year or early next year. Now, I think the report seems to be positive, but I'm not sure whether all the approvals and all the production and manufacturing will meet those estimated deadlines. So it's still all in flux. I think if we look back earlier this year, the hopes were even earlier. So the clinical processes might take a little bit longer than for the Vietnamese urgent need at the moment. So I think that's why Vietnamese government had revised a little bit and started to source outside vaccines rather than waiting completely to their own homegrown produced vaccines.
Okay, thank you. Apart from Vietnam, Thailand is also developing a domestic vaccine, its own vaccine. I think even by University, Chulalongkorn University, where I'm at. But it will take some time. So what I'm thinking is that it just depends on how intense and how long this pandemic goes on for. If it goes on long enough, it keeps going. And the shortage of global supply, all the major Chinese vaccines, the US and so on, if the supply is short, then maybe domestic vaccines eventually will kick in after the 3 trials and so on. So there's still some space for possibly domestic vaccines. I'm going to pose two more questions now and invite the speakers to react to. I mean, one is maybe Dr. Renu, you'd be best placed to look at this, the harmonization, the potential harmonization of vaccines. We have Sinovac, Sinopharm, AstraZeneca around here, a lot around here, Mekong Region, but Pfizer, Moderna, Sputnik, and so on. Sputnik also in Laos. With these different vaccines and different efficacy rates and so on, and there's talk about vaccine passport. How do we allow people to move around again and resume business activity, trade, investment, tourism, and so on when we have different vaccines in the region? Is there a way to harmonize them? Is there any move in that direction? Dr. Renu and anyone else, please.
Yes, indeed, there are many different vaccines being used, and they all have different efficacies, and it is because of the shortage of supply. And so, in terms of a vaccine passport, WHO does not support the concept of vaccine passport for the reason that the access is to specific vaccines is unequal, and so it cannot be used or a condition for entry for travel or entry into country. But in terms of documentation of what vaccine is used, the vaccine certificate and documenting what vaccines are used, that I think that harmonization, WHO is coordinating with many countries with an e-platform to make sure that there is harmonization in terms of operability of the platforms that are used for the purpose of documentation of what vaccines are used, as a protocol for travel that each country determines for itself how they what they decide. But in going forward, there is also a lot of research now that's going on in terms of mix and match of different vaccines, and this is one of the things that we will learn more about. That if one dose is taken with one vaccine, and whether having another vaccine is okay, and whether it is more in terms of efficacy. And there's also research on how long is the immunity when the boosters will be needed. So those are all important areas for research, and we'll learn more about it. But in principle, WHO does not really support the issue of vaccine passport as a condition for travel because of the glaring inequity in terms of access to specific vaccines.
Dr. Renu, does the WHO think that vaccine mixing is okay? Mix and match, one dose, first dose AstraZeneca, second one Pfizer. Is that supposed to be better than just 2 doses of AstraZeneca?
Well, this question has come up because of the shortage of vaccine supply. And in the UK, in fact, studies are going on right now because after the cases of clotting cases came up with AstraZeneca, the second dose was offered for Pfizer. So some people got AstraZeneca and some people got Pfizer. And the data is still coming in. But what we've learned is that using AstraZeneca as a first dose and Pfizer as second, it does increase the reactogenicity a little bit. That means there are more local side effects like sore arm or fever or something, but it also improves the immune response. And we are waiting to see what is the impact on efficacy, and I think this can be okay. But they're also expanding this to expand the combinations to more vaccines with Moderna and Novavax and others. So we learn about that. This is a really important area that's being studied right now.
Okay, thank you. Dr. Hong, can you imagine vaccine nationalism in Vietnam, for example? Vietnam will allow travelers and visitors from places who have been inoculated with Pfizer, Moderna, AstraZeneca, but those with Sinovac, Sinopharm have more restrictions, have more quarantine. Would that kind of vaccine nationalism be foreseeable in Vietnam? Dr. Hong.
Yeah, I was wondering about that when I mentioned the different portfolio of vaccines within Vietnam at the moment. It's very, and we don't know at this moment whether what will be the ultimate percentage of the population which will dominate, because we're still in the phase of where Vietnam is securing different vaccines. So we still don't know what will prevail, what proportion will prevail. And as Dr. Ranu mentioned in the beginning, I think the different viruses keep developing and evolving, and so we don't know whether the current vaccines will be, effective for the future variants. I don't think Delta is it. I think we will see different more variants coming up. So I think the study science and vaccines development will have to catch up with that. Now, to your question about potential discriminatory approach or vaccines nationalism, I don't know. I think Vietnam is still, in terms of debating whether a vaccine passport would be a good idea, even though it's not maybe preferred for World Health Organization. But I think there is also a pressure of opening up to different countries and resuming business and travels. I mentioned in the beginning that vaccines from China were to Chinese citizens or as Chinese people living in Vietnam, or people who travel between Vietnam and China. So that's already an imposed kind of a framework, isn't it? So if Vietnamese nationals that want to do business in China, they need to take Sinovac or Sinopharm, and whether it is I think Vietnamese authorities will have to really have a thought-through strategy towards that, because if that is a condition and that comes with every country and every donation, that we will have a situation where it's quite discriminatory and sometimes maybe even mutually exclusive. I hope it's not the case. But it is the danger of that the politics will creep into the vaccine strategy. So that's something that we need to be conscious of as well. And it's across Southeast Asia, Mekong as well. Right?
Yeah, thank you very much. One bad case scenario that we do not want to see is a kind of a vaccine war or vaccine conflict between the United States and China. If the U.S. And China, if they start announcing that Americans with Pfizer, Moderna are not accepted, they have to be quarantined in China, and vice versa. Chinese with Sinovac, Sinopharm have to be quarantined in the U.S. and not welcome in the U.S. This would set a very alarming global trend and tension, and it would affect this region. So let's hope and let's try to do what we can to make sure that the U.S. and China don't go to conflict, don't engage in conflict on vaccines. Ambassador Sotirak, there's a question about ASEAN and about Mekong in particular. ASEAN is full of agreements and all these committees and bodies and various announcements. And Mekong itself, Ambassador Sotirak, as you know, there's a Mekong River Commission. There's a Lan Chang Mekong Cooperation Mechanism sponsored by China, originated from China. And then there's the Mekong US partnership. There's a Mekong Japan partnership that's now also in Mekong Korea. So the Mekong region is full of agreements with external partners, including Australia and a bit of New Zealand. But on vaccine virus, we're not seeing yet regional cross Mekong regional collaboration through these schemes. We mentioned a bit Australia. I think they're having their own scheme. But for the rest, Japan, US. China has been contributing vaccines, but not through the LMC. So, Ambassador Sotirak, you had some recommendations. Maybe can we hear one or two? How do we promote Mekong cooperation on vaccines? Because individual Mekong countries, if they re-emerge without the others, they will still suffer because the economies and peoples are so integrated and enmeshed. Cross-border trade, migrant labor, infrastructure. Now there'll be a rail link from China to Laos and eventually Laos down here and so on. So, Ambassador Sotirak, what do you see? One or two, what can we do more together in the Mekong region to combat this virus and promote vaccine?
Yeah, thank you, Dr. Titinan, for this $1 million questions. The way I see it, it will play out at 3 levels, unless all these 3 levels jive together. It will be very difficult for the Mekong region to do anything more substantially. Now, within itself, the CLMV-T country, we must take somebody. I don't know. I'm going to suggest Thailand, for example, to take a lead in trying to initiate a sub-regional sub-regional response to COVID-19 and engage the two biggest power in a platform, be it informal at first. It's not a bad idea, but also I've been trying hard to sensibilize with my friend from Mofa, Cambodia, to try to put COVID-19 in a regional, sub-regional context on the Cambodian priority list. I'm not sure, as I mentioned to you. So CLMVT +2 meeting, during Cambodia chairmanship is not a bad idea. This will answer the question, or at least resolve some issue in relation to harmonization and travel ban and all these things that it's going to pop up. And this also shows that CLMV take the matter in our own hand. Now, at the more extended level, regional wide, ASEAN must accept that CLMVT, anything happen to CLMVT, be it COVID or Mekong issues, it's going to affect ASEAN centrality and unities and effectiveness and so on and so forth. So there have to be a more engaged ASEAN in looking at COVID-19 as well. I'm not very happy with the statement that made by we have to revisit. There's no timetable. It just ASEAN aspire to cooperate. How is it that translate on ground? Every country is doing their own now, and what we see is China, U.S., Russia. Fortunately, we have WHO who very committed to help all the country in the region and beyond. Otherwise, it's going to be bilateral: China, Cambodia, U.S., Cambodia, and so on. It's going to be a mess. So at the high level, I think China and U.S. have to stop the blaming game, or even including the EU. They have to stop and looking for way to allow their best scientists to collaborate and finding the best way to make this protocol work for vaccine, for example. Don't I mean, I'm not a health specialist. I don't know the DNA of vaccine, but I would tend to say that there ought to be some kind of protocol that these vaccine can say that if you get a shot from Chinese vaccine, you can travel to USA and vice versa, for example. This would help a lot rather than using vaccine as a political tool to wield influence in all part of the world. So thank you so much. I have no concrete, but maybe Thailand should take a lead. You make your sphere of influence is stronger than Cambodia. Thank you.
Okay, thank you. Thank you very much. Let me just go to the other three speakers for 1 minute each. And maybe, we want to know kind of what to do next, how to proceed, how to move forward. These are policy implications. We want to have some kind of a concrete way forward. So mainland Southeast Asia, CLMTV, Mekong Region, almost 100 million people in Vietnam, population almost 20 million, approaching 20 million in Cambodia soon. Laos almost 10 million, almost 60 million in Myanmar, almost 70 million in Thailand. So this is a region of 250 million people, more than $1 trillion GDP. It's been growing together. It's most dynamic until recently. Now I worry because, as Dr. Renu has mentioned in the figures, 8%, only 8% vaccination compared to the global 22%. And if we re-emerge slow with the economic recovery, this could be a long-term damage. And I think it could sink and it could keep suppress potential of mainland Southeast Asia. So I'll just go around 1 minute each to the other three speakers. Thailand is kind of the hub in a way, de facto by default, but Vietnam also coming up very strongly. How do we approach this in a more Mekong fashion, as a way forward for vaccines and getting out of this pandemic? Can we start with perhaps Thailand and then Vietnam and then WHO? Dr. Pavida for Thailand, in just very briefly, what do you think the next step should be way forward?
Thank you, Dr. Titinan. I think it is a great idea to think of a regional approach to make sure that all the region gets vaccine together. But I think to be realistic, it is a very challenging task because this doesn't come out of the sky and it takes money and investment. So for each country to be thinking about to vaccinate other countries, they themselves have to be sufficiently vaccinated first. So I think that would be the main challenge for any country trying to be more active regionally. That would be my first point. But I think it is an idea not to be left behind for the reasons you mentioned already. And I think another point that is very significant is that, as Dr. Renu has mentioned, the WHO does not support this kind of vaccine discrimination. But we cannot stop countries and we cannot stop the private sector from not discriminating against vaccine. If countries start discriminating against vaccine, that would be very difficult. But we have already seen that another discrimination that we have seen is perhaps the private sector as well. When business that does not allow people who are not vaccinated and all those things. So I think to monitor the kind of vaccine discrimination at different levels, country and private sector, is also something important to keep in mind going forward. Thank you.
Yeah, thank you very much, Dr. Pavita. Dr. Wong, perhaps a minute of last remarks from you.
Yes, I can't speak for Vietnamese government, but I would hope to see that this phase of where Vietnam struggles a little bit with securing own vaccine will pass, and then Vietnam will get back to the initial strength, which is very much contributing and spreading the public PPEs and being an active contributor to the region as it was in the last year. It has supplies a lot of medical supplies to Cambodia, Laos, and the region alike, and across Southeast Asia and beyond. So I hope that will be coming back. Vietnam is now struggling in between both contributing to the global initiatives, but also trying to secure own vaccines. And similarly, Australia and other countries in the region that support the kind of global initiatives like Gavi and stuff like that. So I think that would be an ideal situation. I agree with Dr. Pavin that it's not going to be easy, but at least it would be a good idea that at some point, COVID vaccine will be depoliticized, just like flu vaccine. We have a flu vaccine or not, never mind from which country. So that was a challenge in the beginning because there was a race for all the trials, the medical trials, to be faster. So we don't have a uniform kind of standard agency because we were in Russia and all the vaccines were pushed so much earlier than in the regular circumstances they would have been. But I do also hope that the vaccine politics going forward will be less politicized and less of a tool of great power competition. But we have to be aware that the reality is what it is.
Dr. Renu, how worried should we be in the Mekong region when the Mekong region's vaccination rate is just 8%, very low compared to the global rate of 22%, let alone the US 53%, EU 47%, even Singapore 46%. We're next to Africa. How worried should we be, and what should we do?
Yeah, thank you, Dr. Thitinan. I think with the emergence of variants, we should be worried. It's really a race between the variants and the vaccine, and we have to really speed up on vaccination. Especially prioritizing the most vulnerable groups. All the available vaccines do offer high protection against severe disease. And that is important because we want to keep the severe disease to low numbers. And that's why it's important to prioritize the older people and those with comorbidities. And this can help to keep the number of people who require critical care to a low and manageable level by the health system. And at the same time, we have to keep track of the virus, both in our countries as well as in the region, because keeping track of that will help us to calibrate our response and take timely action in terms of reopening and controlling the virus as we increase the rate of vaccination to exit this pandemic.
Thank you very much. Look, we've come up to time. I just want to bring this to a close. So I think today we are more worried, and I've learned a lot from this discussion. Variants are our object of worry. We have to be concerned about also future variants. I think that we can probably say together that each country in the Mekong region, we have to take care of our own people. So Thailand, Vietnam, Cambodia, Laos, and Myanmar. But at the same time, taking care of our own in one country, also have to keep an eye on the immediate next door neighbors. And eventually, I think somehow the region, the Mekong region, because of geography, the economic imperatives, the borders and so on, they have to somehow find a way to re-emerge together. So, we managed to have to do every 3 to 4 months a virus in kind of update. And I'm sure we'll have to revisit this again in 2 or 3 months down the road. In the meantime, thank you very much to the audience members for tuning in, but also most especially to the experts who are Dr. Renu. Thank you, Dr. Farida, Dr. Hong, Ambassador Sotirak. Thanks very much for sharing your time, your expertise, your effort. Thank you.